I am Wilson Walker, live here at San Francisco General Hospital. We have talked a lot about the people that are going to need intense care at a hospital like this, ventilators, maybe a critical care unit, but there is another challenge facing these hospitals: what to do with the people who are not very sick but need a place to stay where they can get well so they don't infect the people who are not infected.
Please do not go to the emergency room unless you have a true life-threatening emergency.
San Francisco health officials begging everyone to avoid the ER if at all possible. An overwhelmed healthcare system is the very heart of this crisis, and that means finding a place to isolate people who don't necessarily need a hospital.
And you have to look at procuring additional assets, not just for the homeless, but for the general population.
Governor Newsom thinks California will need as many as 20,000 additional beds beyond our current hospital capacity.
This Friday, we will announce the two large hospitals that we have procured that we'll be bringing into our portfolio to address that 19,000 to 20,000 gap.
And the two hospitals are just a start. The state has also identified 960 hotels it might use, along with 1,300 trailers and the possibility of temporary facilities at places like county fairgrounds, armories, and even vacant lots. Now, San Francisco has already started using hotel space for one population.
Those first people were homeless individuals who were tested in the hospital, but are not showing signs that need them to be hospitalized, and so we moved them from the hospitals to that particular hotel.
Today we asked if San Francisco was looking at any other locations to isolate those who do not need to be hospitalized. I am told that Bill Graham's Civic Auditorium was considered but found to be a bad fit for the job. It is fair to assume that other sites are being looked at, anything to take the strain off of our hospitals and our badly needed critical care services.
Those places desperately need to be saved for the people who are truly ill and need them most.
All right, talked about San Francisco General here. We spoke with the leadership here and asked them what their plan was for kind of another little nuance of the challenge, is having people who really do need hospitalization for any reason, but not letting the people who are infected with the coronavirus infect the other patients that are here in the hospital for whatever requires them to be here. I am told that they are going to make one specific floor of this hospital entirely for patients with the coronavirus. They are going to isolate that floor for those patients. Now, in China, when the explosion really happened, they actually cut hospitals in half, truly built walls in the middle of hospital wards to keep the infected away from the non-infected. So all sorts of challenges: taking care of the sick, isolating those who aren't too sick, and then keeping the people that are sick away from the people who aren't infected with coronavirus in the hospital. It is sort of challenge on top of challenge, and that is the preparation that is underway tonight. We are live at San Francisco General. Wilson Walker, KPIX 5.